Hello, my name is Tabitha. I'm with Coloplast. Today we're going to talk about ostomy how-to. It's always important to remember that if your ostomy appliance is leaking and the patient has urine or feces on their skin, you always want to remove the ostomy pouch and start over. Please don't reinforce with tape or use towels to soak up any of the excess drainage. So when we talk about an ostomy pouch change, you want to keep in mind when you are removing the pouch, you want to do a pull-push technique, meaning slowly remove the pouch and push the skin away from the pouch. You can use a warm washcloth also to kind of activate it a little bit and to give you a little bit of loosening of the barrier. Once you have the pouch off, cleaning the skin is very simple. No soaps, no sprays, no foams, and especially none of the bathing wipes or peri wipes. All you want is warm water and a washcloth. Okay, so get the skin good, clean, and dry. You'll want to make sure you measure the stoma. You can use a simple measuring ruler, or you can use this measuring device that's in all boxes of ostomy supplies. When you're measuring, you always want to measure about 1 to 2 millimeters bigger than the stoma. You don't want to get too small or cut over the stoma. So 1 to 2 millimeters. Once you do that, you want to trace on the back of your appliance, just like you're doing here. After you trace, it's always important to cut out on the outside of your line. So once you have your line in place, pull your bag out so you don't cut the bag. It's nice to have a pair of curved scissors so that it cuts really nicely. If you cut on the outside of your line, you're not having to go back and recut so often. So when you cut out, you should see your line completely, and then you get a really good fit and you're not having to go back and recut. So once you've done all that, you have good, clean, dry skin, and you've got your barrier cut. Put it up underneath your arm, put it next to the patient, put it somewhere where the barrier can begin to warm up. Because right now it's very cold and it's not going to stick as well until it's a little bit warmer. So be ready and have that ready to go as you're preparing the patient. Once you put the appliance, take the backing off, keep the backing and put it in the bedside table with the patient's name on it. That way you're not constantly having to go back and remeasure. You can just use your template, okay? Once you put the appliance on, after you take the barrier off, always give yourself a little warmth and pressure right up around the stoma and hold it in place for a little while to get it warmed up to the skin. The barrier has to melt into the ridges of the skin to be able to adhere. Another very important thing is do not allow your patient to get up on the side of the bed, get up to the bedside chair, or go to the restroom for at least 15 minutes after you've applied your pouch. So give that patient some time to allow that pouch to adhere so that you don't have leakage issues. So if you have a problem with a patient and they continue to leak and you don't know why, you've done all the steps right, and you're still having issues, you want to consider what we call Stomadhesive paste. You can get it downstairs from Central Supply. It's called Stomadhesive paste, and it really isn't paste. It's not paste or glue. We don't want you putting it all over the back of the appliance. That will not work. You have to only use it like caulk, and that is to apply it just simply right around where you cut. A little bit goes a long way, so don't use a lot, and that will kind of help seal around the stoma and hope that you have a little bit better adherence and you're not having leakage anymore. If you're still having problems, please call your wound ostomy continence nurses and have them come out and look, okay? Because there are some other appliances in what we call convexity that they can get for you, and that will help with the leakage. The other thing we want to go over today is the clipless closure. This is very, very important because these bags do not have a clip anymore. And a lot of times what will happen is sometimes we will get confused. The bag comes as such, and it's almost impossible to get the feces out like that. So you want to fold the tabs back together so that you can open, empty, and clean easily. If this all gets dirty, take an alcohol prep and clean it up so that there's no smell. The last thing we want is for a patient to feel like they're going to smell for the rest of their life. So in cleaning this, be very, very careful. When you're ready to close the pouch, you cannot just start folding it up and closing it. You have to fold back over your envelope to where you see the white dots on top. A good way to remember this and to teach this to your people who are using this is you say headlights up, tail lights up, bumpers, and then put it away in the garage. It's a simple way to remember headlights up. That's the most important part, to make sure and close the pouch so it does not leak. And I believe that's about it for today, and thank you.